keeping families healthy.
All right, welcome everybody. For all the guests, my name is Dr. Dan. It's good to have you here. Happy Masterclass Tuesday. And if you're ready to learn about hormones, thyroid, stress, all that good stuff, raise your hand and say, aye. Aye. Awesome. And if you're ready to start, say, let's go. Let's go. With the gusto, baby. There you go. All right, you ready to learn? Let's jump in. Who here knew that there were over 50 different hormones in the body? Well beyond 50. So here's just a small list of them. In fact, this part of the brain right here, the hypothalamus, is the controller of all of them. And we're going to dive deep into stress because stress will impact that part of the brain, the master controller of your entire neurology, more than any other factor. And once it impacts that part of the brain, it skews the balance of every other hormone. And we're going to learn about that, how stress impacts our hormones. You guys can see there's quite a bit going on here. Lots of different hormones, kidneys, adrenals, hormones that are being sent to those areas that are causing the production of more hormones, including the stomach. How many here knew that in the stomach there are hormones made, there are brain hormones known as neurotransmitters, and there are body hormones in the gut. So it's very important to have a healthy gut if you want to have a healthy hormonal balance. But I wanted to start here so you guys can see how complex the picture is. The topic of hormones is not a simple one. Endocrinology is not a simple topic, but I'm going to do my best to simplify it enough so it makes tonight worthwhile for you. So you can walk out of here kind of holding something in your hand, something that is applicable, and you can start using right away. But this is really where I wanted to start. And again, you're going to learn about how this can override it all if stress is not controlled properly. We're going to talk about the thyroid, not much about the thyroid, but we're going to talk about it because it is important. But as you saw on the slide before, the thyroid is really on the puppet strings of a lot of these other hormones. So everything going on with the thyroid in the body really is kind of like a secondary or shadow effect of other things and other really more powerful hormones. So we're going to talk about the thyroid, but not as much maybe as some people thought or hoped, but the four puzzle pieces needed for a healthy thyroid. I'm going to jump down to this one. Your thyroid is not going to work if it just simply doesn't have the right building blocks. And what I found clinically after almost 30 years, that typically the problem with the thyroid is it just doesn't have the building blocks in the way vitamins, minerals. If it doesn't have the basics to function or operate, nothing else matters. And if it's depleted or doesn't have the basic needs, and you go to the traditional medical route, and they test your thyroid and it's deficient, what happens next? Can anybody guess? Right? So it's not personalized or customized, which is a big part of the reason why you're here in this room, is because you don't want cookie cutter approaches or information or procedures that are just going to cover the entire community and don't really make sense for your body. But that's really what medicine typically does. They cover everybody with the same thing. But they don't really look at the basic issues to start off with before they start writing scripts. So again, your thyroid needs the basic building blocks: minerals, vitamins, and nerve supply. You guys already know the regions of the neck, C5, C6, C7. There's direct nerve innervation into the thyroid. And it's completely reliant upon, the gland is completely reliant upon the brain getting the signals to it to make it work. So that's another factor. If you have subluxation, if the bones are out of alignment, interfering with the normal communication into that gland, the gland's not going to work very well. No matter how much Synthroid or levothyroxine you take, there's got to be clear communication signals coming through. Healthy HPA axis, what is that? That's the hypothalamus communicating with the pituitary, which tells your thyroid and all of the other organs of the body how to produce hormones and keep the hormones at a healthy state and balance. So when we see H up there, that's the hypothalamus. There are things that can interfere with that. One, we talked about stress, which we're going to get into quite a bit tonight. But you could also have something going on up there structurally. For example, and we're not going to get too much into this, but if someone has an accident and the bone structure moves around up here, it can actually impede on the pituitary. It can affect the brain structures up here, which can mess with the communication coming down. So we just know that if the brain's affected primarily by way of stress, and we're going to talk a little bit more about that, that affects the communication. The HPA axis is just the whole line of communication coming down from the brain. So we'll talk more about that. Healthy gut. The thyroid hormone primarily converts to its active form in your gut. If you do not have a healthy stomach, gut, primarily the colon, the last part of your gut, which is really where all the probiotics are and the microbiome is, if it's not healthy, you cannot convert T4 to T3. So the liver and the gut primarily convert, happens in a few other places, but in a minor way. Almost all of it happens in the gut and in the liver. So if your gut's not healthy, you're not converting thyroid hormone, and everything's going to slow down. What are some of the things that you guys are familiar with happen when you have a sluggish thyroid? What are some of the cardinal signs or symptoms that go along with that? Fatigue, hair loss, weight gain, dry skin, thermal intolerance, cold intolerance. It's a big one right there. This lethargy, fatigue, tiredness, depression is another one. So there's a lot of stuff that goes wrong when you're not converting. So you have the nutrients, but your gut's not healthy. You're not converting it, so everything's going to slow down. And then, of course, an intact thyroid. Is that important? Right? If you've had your thyroid taken out, well, that's a problem, unless you're on a medication. Right? So again, removed or damaged radiation, chemo, I mean, there are different things if you've had it removed. And just jumping back to this, just one last mention on this slide. Thyroid hormone is designed to speed the system up. It's for metabolism. It makes things go. So down the line, as we get into it, realizing that stress is the number one impacting force on your hormones. It'll skew everything else in the body. So if thyroid hormone speeds things up, and cortisol being the number one stress hormone in the body, that's the fight or flight hormone. If you're under a lot of fight or flight and the stress hormone is elevated, cortisol is elevated, and you have thyroid hormone which does something similar, it elevates and accelerates things in the body. And if you're under fight or flight, innately the body is created very intelligently. And so what happens is the innate wisdom of the body knows that if you have too much stress hormone, cortisol, and too much thyroid hormone together, that's a problem. The body will get sped up too fast, the heart rate will go crazy. It's not good. So there are down regulations that are happening. If you're under a lot of fight or flight stress, the body automatically, innately down regulates thyroid hormone production and conversion. Does that make sense? So stress impacts everything across the board. We'll talk more about that a little bit, but I just wanted to introduce the concept and understanding how much stress is going to impact the whole hormonal picture. So there you have it. There's the high testosterone, low testosterone. Men and women both have all of the sex hormones. You guys know that, right? Testosterone, estrogen, progesterone. We share the same exact hormones, but in very different amounts. Okay? I got very concerned about 2 hours ago. I was going through a lab panel with a patient who's 62, and her testosterone level was over 700. A normal testosterone for a woman, the cutoff is 48. So, and I said, well, first question I want to ask you is before you went on it compared to when you're on it now, do you feel any different? Like, how do you feel now? She's like, I'm exhausted. I'm like, so how did you feel before? How do you feel now? She's like, no different. So not only is that a problem, you don't feel any different, but you're now higher than 80% of the men that I look at. So there's a little bit of a problem there, and you probably don't need that much. So there are differences. We don't want to turn you into that if you're a woman, but again, that's testosterone. That's what you Kind of in one picture, you get the idea that's the low testosterone picture for a man. There are insulin issues, there are blood sugar issues, low libido. There's a lot of stuff that starts going south quickly when testosterone falls. And as you're going to learn in a moment, it shouldn't fall as you age. For a male life cycle, once it goes up at puberty, it's supposed to stay high throughout the life cycle, the lifetime of a male. And I've got plenty of blood panels to prove that. I work with 70, 80-year-old men. They come in here and their testosterone levels are at 700, 800 with no drug intervention at all. So again, I think you guys got the picture there of what testosterone will do when it's intact. There's the effects of estrogen on the brain. It keeps a woman's bones healthy for reproduction. All very important things. Very important for brain health, bone health, skin, cardiovascular health. It has some very, very important things for men and women, more so for women. So here's the lifestyle so you guys can get a general idea, understanding of why this is so important and what balance looks like. So there's testosterone, hit puberty, goes up, it's supposed to stay up. All the medical literature shows that. That's how a male's biology is formed, how it develops, goes up, supposed to stay up. There are very specific things that knock the legs out from testosterone as a male and a man ages. It can be reversed, it can be elevated naturally, and quite frankly, the only thing that can rectify the situation are lifestyle changes. That's it. Drugs are short-term solutions that create a long-term downstream train wreck, and you'll see what I mean by that in a moment. Here's the female cycle. How you have puberty, what happens, estrogen, progesterone, they start cycling. And now you have for roughly 40, 45 years or what have you, somewhere around there, you're going to have the monthly cycle with estrogen, progesterone kind of moving around throughout the month. And then you hit menopause, which is the cessation of the cycle, no longer cyclical, and then you go into post-menopause. And what we'll talk about is this. These hormones are supposed to drop off, and that's normal. They're supposed to come down and then just level out. But the symptoms that we associate with post-menopause they're not normal. They're very common. But there are societies and civilizations around the world that have none of the symptoms that women living in Western civilizations have. Millions of women. And some of those symptoms are what? That we know about in perimenopause and postmenopause. What are they? Hot flashes, night sweats, bone loss, weight gain, moodiness. There's a whole list of them, right? And there are, again, plenty of cultures that don't have any of that stuff. A lot of it is lifestyle, a lot of it environmental toxins in the food, air, water that we eat, drink, and breathe. There's a lot of things that skew the picture that create a problem. But the general concept here is it should drop off the hormones, but not to the point where your body's unraveling on you, your life is miserable, and you have all these horrible symptoms. Same thing with a male. You should be staying strong blood work-wise and also appearance-wise, energy-wise, drive-wise. This stuff should not wane. And I have not only the blood work to prove it, but I have patients in here, many of you guys have met them, in their 60s, 70s, 80s, women and men, no symptoms for the woman, and for the men, same drive they've always had. They just haven't been impacted with some of the things we're going to talk about. So natural menopause, that's from the Greek, meno means month, pause means pause. So stopping of your monthly. Marks end of reproduction. Average age is 50.5 to 51.5, and the normal age ranges from 40 to 60. There are some things that can bring it on sooner. And what are those things? Smoking, hysterectomy, stress can do it, bad diet. There are a lot of different things, lifestyle, that can accelerate that. But here's what you know. There's a cessation of ovulation due to loss of ovarian follicles resulting in decreased ovarian production of estradiol. And these two hormones are really important for women and men. In the woman, they go high because the hypothalamus uses those to signal to the ovaries to produce eggs or to release the eggs. Very important part. So Now the ovaries are not really doing what they should. So these hormones in the brain keep going up to try to push the process, but it's, it's just reflective of the fact that cessation is on its way. Number of follicles is genetically predetermined in utero. While you're growing, a woman is growing in their mothers, they have all the eggs in them, and then they come out with those, and you have all of them, 500,000 approximately with puberty, and then they go down to about 1,000 with menopause, and then you're done. So this is really important. This is what I just had mentioned a moment ago, and I know for me to make the statement, it's not only strange, but it's a little weird for a lot of women to hear that because they've never heard that before. They probably have had hormonal issues, have gone to various doctors and said, this is normal, this just happens, this is a stage of life, and you just need these creams, injections, pellets, these caps, you need these bioidenticals, you need this stuff, and every woman needs it. It's just a fact of life. This is just what happens. But the Journal of the American Medical Association, they did a study, and they've done many of them, and they concluded that there was no evidence of such a syndrome. There were too many variables in reporting in too many worldwide clusters of different symptoms. While hot flashes were the most common symptom, they were not universally linked to other psychological or physical ones. Many other complaints such as depression, headaches, irritability, memory loss were found to be equally shared among both sexes, and others were felt to be more accurately portrayed as aging symptoms. But they throw it all in one bucket, throw you in there with it, along with the pellets, the drugs, the injections, the shots, all of that. Like I mentioned earlier, there are civilizations. You can go to Indian tribes in South America, the Maori Indians in New Zealand, the native Indians in Canada. There are these different places around the world, Asian countries or Asian civilizations, that you go there and the women have none of the symptoms that we have here. But when they are moved over here, they migrate to our country, what happens to them? They acquire the exact same profile of symptoms. Why would that be? Food. We have more chemicals in our food, genetically altered, chemically altered, right? A lot of this stuff is not our fault. We've been poisoned for a long time in the air, the food, water that we drink, breathe, that we cook in, our pots and our pans, the forever chemical, it's all in there. So that has a dramatic impact on our hormones. What are some of the other things? Stress, absolutely. How about the amount of medications that we take? Starting long before the menopausal symptoms would show up. Right? Most of us, including me, I was born into medications. By the time I was 15, I probably had 150 rounds of antibiotics. I had tons of meds in my body. I grew up in a medically oriented family. And if I sneezed in the other room and my mom heard it or I cleared my throat, she brought me to the pediatrician. I mean, it was like a split second. There was no delay. So medications can really skew things for men and women. So we have to understand that it's not a solely, like, only an American phenomenon, but it's a much more prominent problem in our country. So again, that's from PubMed, Journal of the American Medical Association. And the same thing for men. Raise your hand if you've ever heard of menopause. That's a real thing. I didn't make that up. I didn't put that there to get creative. Fatigue, tiredness, depression, irritability, anger, loss of libido. This is kind of what happens to men once they're crossing 40. Certainly after 50, this is what's going on in our communities. And it just shouldn't be that way. Testosterone starts going down, increased risk of heart disease, diabetes, blood sugar is skewed. So this is a big problem. But is it normal? It's common, but is it normal? This is all lifestyle driven. And the only way to fix it, the only long-term healthy way to fix it is not taking you as a woman and driving your testosterone level up to 700. Thank God that doctor is doing regular blood work, but most are not. The medical doctors and the DOs in our community are not checking on their patients' blood work, And if they are, they're waiting very long periods of time to check back in. And the estrogen on this woman was 50 times, the total estrogen on her blood work, 50 times what it should be. Actually, sorry, it's supposed to be under, for a postmenopausal woman, under 0.5. Hers was 54. So that's not 50, that's what? That's 100. 100 times more estrogen, and her progesterone the same as well. So again, that's what the allopathic profession is focused on right now, to not even get you in a normal premenopausal range. It's to drive you through the roof and then tell you it's okay while you feel horrible. Not 100% of the time, but I would lay this number out there, at least 90% of the patients I sit down with, and I have a lot of patients in here who take testosterone or hormone replacement therapy, estrogen, they do the pellets, the injections, they do whatever, some form of it. I would venture to say at least 90% of those who I sit down with and I review their blood work, and these numbers are astronomically high, I ask them, how are you doing? How do you feel? Because there had to be a reason for them to want it. So that's the first question I ask. Do you feel better being on it? Because I want to respect where they're at. If they say, yeah, I feel like I'm a new person, I'm like, all right, you want to stay on it? They'll probably say yes, right? But hardly any of them, if any of them say, I feel great, just like the lady earlier said, no, I feel horrible. One person said a few months ago, I was talking, she's like, I feel like I'm dying. And her testosterone level was at 850. And she's 58 years old. The doctor's happy. The doctor was high-fiving her because it wasn't in range. We got it 50 times the range. What I'm trying to get over here is that it's not a viable answer. It's not a long-term viable solution. Does that make sense? The only way out of this mess is lifestyle intervention. That the simple stuff is what changes it or it brings balance back. It's the natural design, God's design of the human body. When you work with it, not against it, working against it is driving up to a 700 testosterone level. You're working against it. And the analogy I used with this lady, I said, if you look out in nature, go outside right now, God's got it all in perfect balance. Do you ever see a tree out there that's 1,000 feet tall next to everything else? You ever go out there and see that? Like that would be an anomaly. God wouldn't let it happen. That just doesn't happen. Maybe in an appropriate place like the redwood forest, but not here, right? And the same thing with a number. If your doctor's doing that to you, you just have to sit back and say, does that seem right? Here is conjugated estrogens. This is one of the solutions that medicine has. Premarin from where? Pregnant horse urine. I will take the night sweats and hot flashes all day long, okay, or the moodiness or whatever it is, because here are the common side effects: nausea, indigestion, stomach pain. So what it's saying in essence is the drug now is really throwing your microbiome off, your gut is off, and everything's going to be off. Your thyroid conversion, your detoxing of the estrogens out of your body, a lot of things that we're going to talk about in a bit. So look at all the things that go wrong in the body. And that's the drug company disclosing that in their insert. So if they're willing to disclose that, what really is going wrong in your body that they saw and knew about during the drug trials? So that's just one thing. So again, maybe it's right for you, maybe it's not. But tonight's not so much about the information up on these slides. What my hope and prayer is, as time goes on and as I care for you and your families, is that you begin looking at health through a different lens. That lens begins with principle. What are the general principles of how God has created and designed the body to get well and stay well, and how do I work with those guiding principles and not against them? The more you work with them, the stronger you and your family, your children are going to get. The more you work against them and try to outsmart your body and that wisdom, the worse it gets. The harder it is to win at the health game. So moving on, This is another one, the Women's Health Initiative. It actually increased a woman's risk of breast cancer and cardiovascular problems. So the Women's Health Initiative followed 16,000 women. It was found that women taking hormone replacement therapy were more likely to what? I mean, we already have enough stuff in the environment working against us. You know, in the water, in the food, the air. Why do we need more to generate breast cancer? There's already enough in the environment. Stroke, heart attack, or blood clot. The increased risk of breast cancer became evident after about 4 years of hormone replacement therapy use, but the cardiovascular risk appeared just a year or two on the drug. Journal of the American Medical Association. Now, what's interesting, a lot of people who like to use hormone replacement therapy, clinicians for their patients, they actually have, in recent years, I've seen this come out, where they took this and they spun the study. And they said, well, that's not actually really what happened. You know, 41% increase in strokes, 29% increase in heart attacks, doubling rate of blood clots, breast cancer. They said, here's what happened in the study, the ones who really are still trying to push this stuff. They said the women in the study who are a little younger, closer to postmenopause, who are just starting, they were okay. It was the women who waited too long to take their hormone replacement therapy, and they were closer, like maybe they were 15, 20 years out from the onset of menopause, that they're the ones, because it could help them less down the road. And they're the ones who skewed the study. So this is the stuff you see coming out. And now, I guess you could argue either way. I mean, you could have someone here who's a hormone replacement therapy, expert, and say, no, I got some slides to show you as well. And I could prove the other side. But you know what it really comes down to? It's not information. It's, what's that? Yeah, it's not what to think, it's how to think. It's not what to think, it's what? That's why you're sitting in this room. If you're just coming for a blast of information, long term, that's not going to help you. It's not just about your spine, it's about your mind. It's got to shift. You got to see it through a different lens, a different principle. If not, you're never going to get well or stay well. You got to see it differently. Am I working with the body or against it? It's not about the information, even though I think this is important, but it's about long term. Is this a viable solution, healthy solution that is working with the natural innate design of my biology? Is it or not? This is a big one right here. You guys hear these testosterone replacement therapy mills? Got a lot of them out there pushing it. Pump this stuff in. You feeling like that? We knock that stuff in there, man. You're going to be sprinting. Get you to the Olympics, baby. I told you, almost all the people I sit down, whether I sit down with men or women, they're on this stuff. They got a ton of it running through them. Their numbers are astronomical. That's the first question I ask them. I say, how are you feeling? Because I want to hear them say, I feel great. I would never change a thing. I want to stand up for the rest of my life. That's not the case. So maybe it is for some. I can't speak for everybody. Maybe there are people in the community who would say that. But I simply don't come across those people. So again, not only is it, maybe it works, maybe it doesn't, but here's what happens, the side effects. The longer you're on it. Does anybody here remember? I remember like being in high school, the kids on steroids, taking testosterone. That was a big thing when I was in high school. And I remember how scary it was. Like, I remember kids getting like brain tumors and, just cancer, and like horrible things would happen to the athletes who were taking, the bodybuilders who were taking these drugs. You guys know what I'm talking about? Like, they would warn us. They would have classes on it. There'd be announcements, don't do this stuff, it's bad for you. And all of a sudden it became faddish, right? They started selling it to us and pushing it on us. Fluid retention, acne, swells the prostate, breast swelling, tenderness. It actually thickens the blood. So it increases your likelihood of clots, thrombi, embolism, heart attacks, strokes. Bad stuff. All right, maybe you feel like that guy for a little while, but then it all comes crashing down when you have a heart attack or stroke. So again, a lot of bad things happen. Birth control. Good or bad? Right. I am appalled at how many teenage girls are on birth control in this community. It's unbelievable. And some of the people that their kids, it just shocks me. Some of the people I know, the parents that are putting their kids on this because a doctor told them that their 13, 14, 15-year-old daughter needs this to regulate their cycles. Yeah. So look at this, causing kids. This coming down to the bottom here, 1.8 million women who are following on average for almost 11 years. The risk increased, so 10 years, you on it for 10 years. It increased to 150% increased risk of cancer. That's what that number is. Just kind of simplify the slide for you. There's a lot of stuff up there. Again, more information, but what I want you to take away tonight is to understand, what is it doing in my body? Is this a good idea? What type of price is there to pay? What consequence? What happens when I take this? Something is altered and manipulated in my physiology, my biology. The longer I take it, the more skewed it gets. So what are the things that can happen? I'm not anti-drug or anti-surgery. They're needed short term, but what we're talking about is a long-term healthy lifestyle vision for you and your family. Right? You guys with me? Right? That's what it's about. How do we arrive in a healthy state 5, 10, 15, 20, 25, 30 years from now? We have a quality of life. We have energy. We feel good in our bodies, our brains, our minds. It's starting first with principle, these guiding principles. What happens when I put this stuff in my body? Birth control increases stroke by 50%. Why? Because it coagulates the blood. It thickens the blood, just like the testosterone. By the way, they're not recommending, if you came to the Heart Master class, they don't recommend an aspirin a day any longer. It's 2019. Why? Well, for a lot of reasons. There are a lot of side effects, but one of the things that's seen and now understood, would have been understood a long time ago if they understood principle in medicine, is that as you thin the blood every day, month after month, year after year, decade after decade, you can't outsmart the innate wisdom of the human body. She will always win. That's God's intelligence within the body. You keep thinning, thinning, thinning. She said, I don't like what you're doing to me. Keep thinning. What is it got to do? It's going to bring you the other way. Try to swing the pendulum toward thick blood. And that's why heart attacks and strokes go up in probability the longer you take aspirin. I'm not saying coming off like an open heart surgery, not a bad idea, keep things really thin. I'm not talking about that. I'm talking about long-term lifestyle strategies and impact. Out of the 50-plus hormones, the one that has the greatest impact is what? Cortisol. That is the stress hormone. So what happens normally, what you're seeing right here, cortisol is a normal regulator. We need cortisol. We need it coming out constantly from the adrenals. It helps regulate blood pressure, immune surveillance. It helps with blood sugar management. It does a lot of important things. It's not a bad hormone. But in times of fight or flight or freeze, sympathetic dominance, stress, it goes up significantly in preparation for fight or flight. Does that make sense? Now, so normally, cortisol, like if you're driving on the road, you can have maybe ambulances and cop cars and just all this stuff is using the same road. They're all going down the same road. And that's the same thing with cortisol. It uses the same pathways, the same organ and gland effect. It has all these, the same exact metabolic pathways. But if the hypothalamus interprets any physical, emotional, chemical stress in the environment as a threat, the hypothalamus, the major master controller of the body, of the neurology, it will release corticotropin-releasing factor to the pituitary, which is right up against it, and then the pituitary will release adrenocorticotropin hormone to the, what are these? Adrenals. Adrenals are the kidneys. Renal means kidney, and basically all those are, the adrenals are just kind of like an outcropping of the kidney. It's just a gland, but it's part of the kidney. It is the kidney. And what it does is it pumps out very large amounts of cortisol. So what happens is in the body now cortisol takes over. Everything's reappropriated. Everything's pushed to the side. You get out of the way. Traffic stops to make room for the emergency vehicles, which is now the cortisol. So there's no need for feed, breed, rest, digest. Now it's all fight or flight. When you're under chronic levels of stress, waking up in stress, you're sleeping in stress, the stress never ends. Cortisol will go high and chronically stay high. Does that make sense? And that's the cortisol. That's the emergency vehicle coming through. So cortisol is released based on physiological need. It's always there. It's acutely protective, but is not meant to be maintained at chronically high levels, only for a short amount of time. Okay? Someone goes, boom. You get scared. Cortisol, your heart jumps a little bit. You get cortisol jump. Okay, fine. But minutes or certainly hours later, should come down a little bit, right? So, but people live that life with the emergency vehicles coming through. Under fight or flight, appetite decreases, tissue repair stops, reproductive processes slow, hormones slow, and immune system pauses. What they call this is, it's called cortisol steal syndrome, which means this. Your hypothalamus is normally telling the testes, the ovaries to produce hormones, telling the whole body to produce hormones. And sex hormones, testosterone, estrogen, progesterone. Your brain's constantly kind of conducting that symphony through your body. But under chronic levels of stress, your hypothalamus reappropriates all of its focus toward cortisol for the most part. It says, I'm going to deplete all the resources going to the other hormones, cortisol steal, and reappropriate resources to produce as much cortisol as I possibly can. And when that happens, testosterone comes down, estrogen, progesterone, progesterone mainly. That's impacted by stress more than any other hormone, sex hormone. So the hormones are depleted. When you're under fight or flight, your body does not care about reproducing. Okay, so if you're under a chronic level of stress, it's going to be very hard for a woman to get pregnant. Very hard, because the cortisol is stealing away the hormones that are necessary to not only get pregnant, but to maintain a pregnancy. So it's also going to affect the stomach. You can develop digestive issues because the stomach rest and digest. You're not going to be able to digest as well. It's going to create microbiome problems, hormonal issues, immune system. When you're running for your life, physically, maybe figuratively, your body really doesn't need much appropriated toward immune system surveillance. Does that make sense? So your immune system gets weaker. Cortisol has a very negative effect across the board. And that's why it's really important that all of us, including me, for a long-term health picture, every day we have strategies, we have techniques that we use to bring down that stress, to manage it, to control our reaction, control our response. Because we can feel it. What are some of the things that we feel when stress is really impacting our physiology? What are hot?
Panic.
What's that? Panic. What else? Heartbeat. Heart starts racing a little bit. Sweating. What's that? Brain freeze, right? Oh, cranky. Okay. Cranky, feisty. You can't. Your memory, by the way, cortisol impacts the hippocampus, shuts down your short-term memory. That's why after a very traumatic event or something very stressful happens, it's very hard to remember events surrounding, memories around that event. There was one more I missed over there I wanted to get. What's that? Blood pressure goes way up, right? So all these negative effects, but they're supposed to happen. That's what happens with cortisol. But in the process of that happening, now all of the other hormones suffer. Are there people who live day by day in very high levels of stress, chronically high levels of cortisol? Sure. And after a while, the innate design of the body, guess what happens? Yeah, you learn, it's almost like a compensation. You can learn how to adapt to that very elevated state of stress. And people just kind of go there and just stay there. But while they're there, all these bad things are happening. Now, I talked about the gut, okay? The nervous system, the hypothalamus, does not care about digesting your food when it's in fight or flight. So what's going to happen is the gut is going to suffer. Down here, this is the small intestine. Stomach, it empties into the small intestines. And then eventually it goes ascending, transverse, descending. This is the last part, the distal part of the colon or the large intestines right here. This is where, from here to here, that's where like 99% of your microbiome is. All the probiotics, all the bacteria help make hormones, brain hormones, neurotransmitters, and body hormones. Also, in this gut here, thyroid hormone being converted. There's conversion and there's also detoxification. If you don't have a healthy gut, then all of the used up hormones in your body, they have to get out. They got to be pooped out quickly. And if the gut's not healthy, there's something called auto-intoxication. The things go right back into the body. Estrogens elevate, you go to do a blood test, your estrogens are high, everything's skewed, so the doctor gets a skewed reading. Meanwhile, the real problem could be the gut. So we know that the gut is a huge player in hormonal balance and conversion. One of the things that's absolutely critical to getting rid of the used up hormones and getting them out of the body quickly is a healthy gut, healthy motility, fiber. Fiber is critical, getting the right amount of fiber. Bare minimum of 30 grams of fiber every day. Critical for normal hormonal health. A minimum of 30, 40, preferably 50 or higher grams of fiber. If you're worried about your hormones or they seem skewed, that's one measurement, that's one metric you may want to start tracking if there's only one metric. It's the amount of fiber you're getting in every single day. And there are tons of different sources of fiber. The fiber helps carry out. Not only does it help move things through, so the gut is working properly, but it helps carry out the toxic used up estrogens. So here's how we make the cortisol picture better. And I'm going to go through these little by little. First, of course, the foundation, which almost everybody in here is tending to. Healthy nerve supply, healthy structure. That's very important, yes? Yes. Nerves coming out of the spine have direct innervation into all the glands and organs involved with hormonal control. If you are not under regular chiropractic care, we offer all guests in here an opportunity to get their spine checked at a special rate. Talk with me. Come up to me after the master class, and I can talk to you more about that. Or if you're not from the area, I'll try to find you a chiropractor closer. But whether here or somewhere else, this is a non-negotiable. You want to have this in the picture. It's critical. And it's in fact at the foundation. Sleep. I'm going to talk a little bit about circadian rhythm, the biorhythms of hormones, how important that is. Is sleep important? Yeah. Raise your hands if you think that most people get really good, adequate, deep sleep every night. Yeah? Raise your hands if you think not. Right? Most people struggle. Most people struggle. The majority of people struggle with this category. They do not sleep well. It's rare that I meet somebody who says, man, I sleep like a rock. Every night I sleep great. I wake up, refreshed, I feel it. Most people are talking to me about their sleep disturbances, and there's a way to try to make that better. But sleep is critical. If you're not sleeping, cortisol will not balance. It will not come down. Why? The adrenals, the site of cortisol production, need a lot of rest. They need a lot of recovery, a lot of downtime to repair, to work efficiently. If they're not repairing and rejuvenating, your cortisol will never balance. Stress management. You have to figure out what's going to help you. Scripture, what stress management technique is going to work for you, or strategy, support networks, friends, family, counseling. What is it going to be in that category? What's going to help you the most? Music is great. Meditation. What are some of the things that relax you, chill you out, or bring you to the parasympathetic feed, breathe, rest, and digest? Basking in the sun. Vitamin D, right? Vitamin D will bring that cortisol down. That's a good one. You got plenty of it now. What's that? Walk along the beach, exercise, right? Breath work? Dogs? Pets? I felt that last night. Both dogs, my little puppies came up to me, and I was sitting there petting them. They're looking at me, and they're licking me, and I walked away. I'm like, oh, I feel better, expressing that kindness, and that pets have a dramatic impact on our bodies and our physiologies. So there's so many things that can go into that category that'll help cortisol. We can manage it. There's so many things that we can proactively do. Proper movement timing. Tonight, I'm not going to get into the cyclical part of it, but if I work with you one-on-one and you're a cyclical woman, you have to watch out with the type of exercise you do. You have to be very careful with introducing certain types of exercise at certain times of the month, because you can really kick the legs out from under your menstrual cycle, your monthly cycle, and the balance of your hormones. You have to be very, very careful. So if you're a cyclical woman, you want to talk to me about that. I'm not going to get much into it tonight, but the things that help support testosterone, progesterone, estrogen and balance the best: weight training from male, it's high intensity interval training, speeding up your heart rate. Walking, you can do this. Walk very briskly, get your heart rate up for a minute, as fast as you can, and then go to a slower pace. Then do the same thing again for a minute, 30 seconds. Do that 3, 4, 5 times. That's a HIIT training right there. You can do HIIT trainings many different ways, but getting your heart rate up. I did that this morning on my treadmill. 30 seconds, as fast as I can run, rest for 30 seconds. 30 seconds up, 30 seconds down. I did 10 minutes of that. Got my heart rate up, felt great, and it helps balance hormones. So proper movement timing, diet, the thing that will dietarily and physiologically impact your hormones the most: high blood sugar, high insulin. So you have to make sure that you're keeping track of that on your blood work, right testing. We'll talk about the Dutch test in a moment. Detoxification, heal the liver and the gut. Many times when I do hormonal testing on patients, the lateral movement that we make is we bring in additional testing on the gut, the GI map, and we genetically map the gut to see what the health status of the gut is, alongside of trying to get their hormones balanced. Herbal and stress supplements. We're not going to get into that tonight because my preference is first testing and understanding what you need. That's a more personalized approach. It's customized. That way I can know what you need and what you don't need. The right testing is important. So there are herbs. I'll talk a little bit about this, but the most important thing you can do so you're not wasting time, energy, and money is figuring out exactly what your body needs, what it doesn't need. Testing is the only way to do that. What that says here: medication elimination. Some people can't come off their medications, but at a bare minimum, as time goes on, working with the doctor who put you on them to see if you can at least reduce the amount of medications you're on, and potentially long-term maybe eliminate them. But that's between you and the doctor who put you on them. I could certainly give you the information to help you, but it's probably safest that you work with that person who put you on it. And then you have up here, CANI, constant and never-ending improvement. The medications will severely skew the hormonal pathways. There's not one medication that doesn't the longer you stay on it. It's just how it works. What we have here, the subluxated, this right here is something we do in the office, the pulse wave profiler, the adaptability index that we look at. This is measuring resiliency to stress, your resiliency marker. So what we look at, and just kind of give you a basic overview, is what you have is, again, the hypothalamus is up here, and it's regulating, monitoring, controlling the body, directing, orchestrating, managing every aspect of the body. Hormonal health, these nerves come out, and they're going into ovaries, testes, pelvis. They're going to the thyroid right here. These nerves go right into the thyroid. So from the spine, you have wiring that's literally directly controlling these organs and glands. And you'll see the color coding. You have yellow, and you have green nerves. The yellow nerves are the fight or flight nerves, sympathetic, fight or flight, or freeze. And then the green nerves are the relaxatory, feed, breathe, rest, and digest. And every organ of the body has a gas pedal and a brake. Many of you guys have gone through this with me. During your exams, your re-exams, I go through this. And again, gas pedal, brake, gas pedal, brake, gas pedal, brake. Isn't that cool? How every organ, because we need both. We need gas pedal and brake. So what happens is this. The goal as we care for patients in here certainly is we want to achieve balance between gas pedal and brake. We want both working well with one another. So again, down here, if you're able to see it, fight, flight, sympathetic fight or flight, freeze. So that hypothalamus, as you're going throughout the day, it's a surveillance system, and it's looking out on the horizon and looking at physical, emotional, chemical stressors, and it's trying to, moment by moment, identify whether it is a threat or non-threat. If it's a threat, it hits the gas pedal. If it's a non-threat, it hits the brake. Here's the vagus nerve. The vagus nerve is a brake. When you do deep breathing, yoga, different modalities can influence that vagus. Adjustments influence that vagus. The cutting-edge medical therapy now are vagal implant stimulators. They're implanting them in the neck and giving you a button to electrify your vagus, to stimulate you into relaxatory. And they're using that, some places studies have shown effectively for like bowel diseases and all kinds of different things to modulate the inflammatory reactions, autoimmune diseases. But again, is that really a long-term viable solution? Probably helping those people a lot short-term, for sure. But again, that vagus nerve is the brake. And we can influence that by way of, when we adjust you, we influence that. But nonetheless, it's going to hit the gas pedal or brake depending upon what's going on. The reason why, the hypothalamus is there for survival. The main purpose of the neurology is survival, to keep us alive. And it'll do whatever it needs to do to keep us alive. That's what the innate wisdom wants to do. It wants you to live. So what we're trying to achieve again, and what I'm going to show to you briefly here and then we'll move on, is we want to, as often as possible when we redo these for you as a patient, it's not always the case, but the pattern, the dominant pattern, is we want balance between gas pedal and brake. And ideally, we want you in the middle, the adaptable wellness state, or the most resilient place you can be. This is a non-feeling test. This shows us what we cannot feel. I get this study done on my body regularly as well. And so I want to make sure that most of the time I'm up here. So we're looking for balance. Here's an example. Many of you have heard me use this example over and over. We're driving on I-4, and someone runs us off the road. And I had a patient say to me, you don't need to be run off the road. You just drive on I-4 and your blood pressure will go up. I said, imagine driving and you get run off the road. They're like, and your blood pressure goes up. They're like, I don't need to go off the road. I just think about getting on I-4 and my blood pressure goes up. But you go off the road, we should react. Our cortisol should go up for survival. It's a threat. But if we're 2 hours down the road and the brake hasn't kicked in to recalibrate things and the vagus isn't trying to recalibrate and rebalance things out and chill the system down, now we have a problem. And that's what I mean by the chronically elevated levels of cortisol and stress. Now, you could get locked. People could become dominant at one side or the other. Whether they could be on brake or gas pedal, you can go either way. Most people go gas pedal. And when that happens, it sets up a highly inflammatory physiology. And in an inflammatory physiology, bad things grow. Diabetes, cancer, on and on and on. So what we want to simply see, this is the gas pedal side, this is the brake. On here you can see this person's clearly on the gas pedal side. So what we have, and we have a kind of a newer version of this, but what we have is we usually list two scores here. We list balance and then we list power. How much bandwidth does the nerve system have and how much balance. So that's ideal. It's one of the ways we measure the long-range effects of stress on the body and the effects of cortisol on the body. Where is your physiology? Where is your neurology? How do we measure that? Again, it's different than a blood test, but it's very important. If we're working with your spine and your neurology, we want to understand this picture. And by the way, there are things that can influence this. We talked a little bit about some of those. Deep breathing, walking, nature, pets. Well, there are supplements that can influence your heart rate variability or your cortisol balance. Green tea, curcumin, fish oil. How about that? There are supplements, there are foods that can heavily influence this picture. So one of the things that we look at sleep hygiene-wise, we call it sleep hygiene. If you do not sleep, you cannot heal and have balanced hormones. The Dutch test that we have here, which as far as I know, no doctors in the community are using, certainly medical doctors, they don't measure this. They'll look at your hormones on a blood panel. They look at the quantity. But they don't look at the quality. They look at what you have, but they don't look at where those hormones are going or what they're doing as they're metabolically moving through your body. That's what this test does. It shows you what those hormones are doing inside of you. One of the things that we look at on this test is, for example, the influence of cortisol when you wake up. So we can see when you wake up, cortisol should be in a certain place on this graph. If you're not resting well, your body's out of balance, chronically elevated levels of cortisol, you're going to wake up with your body already sprinting. And we could see cortisol already really high. We look at melatonin. Melatonin, as cortisol is supposed to be going down as you go to sleep, and melatonin comes up. They inversely cycle throughout the day and night. And so a lot of people are waking up with really high cortisol and very low melatonin. Their hormonal picture is skewed, but the point of putting this up is so you can see that there are studies and tests, there are lab reports that could accurately show you what's going on in your body, why your hormones are imbalanced, and if we could see it this clearly in this much detail, then there's a lot of fixing that we can do. Sleep architecture, light goes right through your eyelids. Raise your hands if you knew that. If your eyelids are closed, do you know that light can go right through them? Yes? Smoke alarm with a red LED light while you're sleeping, your brain is registering that it's disturbing your sleep. Street lights disturbing your sleep. Lights that are coming under, the lights seeping under the door. Maybe a light out in the hallway or a night light or something like that. It's going to disturb your sleep. So many of you guys, there are a lot of reasons for sleep disturbances. There are a lot of reasons why people struggle with either going to sleep or staying asleep. At a bare minimum, this may not be the full answer for you, but at a bare minimum, you've got to pay attention to the basics. And understand any light source has the potential of seriously disturbing your ability to sleep deeply. So you have to take inventory of all the light sources in your sleep environment. Very critical. Don't underestimate what a small amount of light in your sleeping environment can do. Cave-like darkness to get deep, restorative sleep. Very important. White noise, a fan. I have a fan going every night. Do not eat. You eat too close to sleep time, you will have sleep disturbances. The time that I really began understanding this is when I got my Oura Ring, my sleep score, and my resiliency rating. I get all kinds of ratings from this biometric technology, the Oura Ring, and without fail, every time I have a meal too close to sleep time, it annihilates my score. It detonates all my biometrics from being good or great to being poor, or like there's an alert that goes off and says like on my app, like, what's wrong with you? Did like something went really wrong? Are you okay? Are you alive? Should we dial 911 for you? Like that's the impact that eating a meal too close to bedtime will have. If you want sleep disturbances or you want to create health problems, then put your meals right up against your sleep time. Again, it's not a game of perfect, but at least try to do that most of the week, keeping the meals at least 2-3 hours away from your sleep. Again, if you have a biometric tool, it will prove that for you. You will see a radical impact from meals too close at night. Alcohol, caffeine, hard training at night, stress, blue light. This is the hardest one for everybody right here. Get the devices out of the sleep environment. I know I struggle with that too. Raise your hands if you struggle with that one. Almost everybody does. I do too. I'll admit it. Okay? It's really hard. But it's incredibly detrimental to the hypothalamus, the pineal gland. These parts of the brain are being impacted by that blue light. And it's very detrimental before sleep. Well, it's detrimental in general, but especially before sleep. It's a hard habit to break, but it's very important that we get consistent with elimination. Getting up roughly the same time. Again, there's some things that change in different stages of life. You're a new mom with babies? All right. you're not going to be getting up the same time and going to sleep the same time. I mean, I get it, okay? So there's some variance in here depending upon your stage of life, but this is an important thing to eventually get in rhythm with. An evening walk, comfortable bed gear, cooler and darker room, cooler temperatures. Even though in the past I always liked sleeping in a warm room. But then I started tracking my biometrics. And the colder the room got, the better I slept, the more rejuvenation I got, the higher my ab scores went. These crazy things I saw. My heart rate dropped lower, my blood pressure, I mean, everything improved. So I don't really like having a cold room, but I'm dealing with it. And I have a hoodie on now and whatever. That's it. I deal with it. But I know my sleep is much deeper. So bedtime routine, relax, Epsom salt baths, sleep architecture. There's so much more to it. But these are the basics. Get these dialed in. Start shutting down the exposure computers, just working on these things little by little, picking one. It's a big list, but just try to pick one and work on that one. Get into the great outdoors, green space exposure is associated with wide-ranging health benefits. Right? How about that? Who would have thunk it? Getting outside. Get barefoot. As much as I can, I get out on my lawn, I walk around barefoot, get to the beach, toes in the sand. It reduces your diastolic blood pressure. Salivary cortisol comes down. Nature, right? Simple things, lifestyle interventions. You got to do the basics. You got to do the basics because no therapeutic intervention can take the place of the basics. You see? Does that make sense? Right? You got to get to cause. You got to bring balance back, and then you got to work with the body, not against it. That's it. So, yeah, this is a very important medical journal, environmental research. This is PubMed research right here. Salivary cortisol, decrease in heart attacks, strokes, all-cause mortality. It helps with heart rate variability. HDL goes up, LDL comes down. Lots of benefits of getting out there and getting exposed to the great outdoors. So stress-busting foods and supplements, again, for the colon, you got to keep that gut healthy. That's where the hormonal conversion is happening. Thyroid hormone conversion is happening. That's where all the bad estrogens, the bad used-up hormones are being conjugated. After they're detoxed in the liver, they're sent to the gut and the bowels to be pooped out. And if the bowels are not healthy, you can't get those hormones out. They recirculate back into the system. Not good. That's what all that helps with. Healthy fats keeps the body lubricated. The sex organs lubricated. It keeps the cells lubricated. Good fats, good oils. All of the hormones, the sex hormones, are made out of fat. You need a lot of fat to make sex hormones. Progesterone, estrogen, testosterone. Omega-3, very important. Raise your hands if you've had your omega-3 index tested in the office. O3 index. Many of you guys are tracking that. You want it between 8 and 12% for optimal brain and body hormonal balance. Why? The cells are made out of EPA and DHA. So you want to have that number at a certain percentage, 8 to 12%, to optimize the cell membrane health. And that allows the hormones to tell the cells, the membranes have to be healthy for the hormones as they hit the cells to instruct the cells what to do. For communication, for good communication, cells need to be healthy. Omega-3s, fats, being on a high-quality fish oil, eating fish regularly. Adaptogens are for the adrenals. Adaptogens feed the adrenals, help balance the adrenals, keep them healthy, and allow them to produce cortisol and a lot of other hormones. Ashwagandha, maca root helps with testosterone balance. Rhodiola, ginseng, astragalus, turmeric, medicinal mushrooms. These are all great. We have these in individual formulations and blends, and these are great, especially for people who have burnt out adrenals, which can be measured on our studies. So GABA, magnesium, and vitamin D. Get outside, get your vitamin D. That's the best way to do it. You could supplement with it. Magnesium, the product that I take at night, Dr. Leif as well, I use what would be considered like a biohack. I do CBD some nights without the THC, okay? I don't go to sleep. I don't use it to hallucinate. So I had a question earlier, does it have the THC in it? No, you're not going to fail any drug tests and lose your job. The CBD, it's very relaxing. It can help people who have trouble falling asleep as well as staying asleep. Not everybody does it work for, but most patients who take it. I actually take it most nights of the week just so I can get even deeper sleep, and I monitor it with my Aura app to see the effect, and it has a great effect. GABA is another supplement that we use. GABA pushes you, along with CBD, into parasympathetic, relaxatory, allows for better healing. It supports the adrenals. The GABA powder that we have has magnesium. It has myo-inositol to heal the muscles. It's got taurine for the heart, for the body in general, for the brain. It's got a very high dose of magnesium for a relaxatory effect. So GABA and CBD are great for stress modulation, cortisol control, cortisol balancing, and deep sleep. I have some patients who use both together, but usually one will work for you alone. CBD is very potent. Usually GABA works really well. If it doesn't, we usually we escalate the situation, and then we go to CBD for those who really feel like they need it. But these are some of the things that we use. And then what we talk about in regards to the hormones, something to understand. Who in here has had their blood hormones tested? You've gotten a panel and you've seen your blood hormones, testosterone, estrogen, DHEA, right? So a lot of you have done that. That's a quantitative study. It's looking at the amount of the hormone in the blood. But like I mentioned, the Dutch test shows how the hormones are moving through the body, where they're going, what's happening, how they're moving through and getting out, or if they are getting out of your body properly. It's a P test, comes in a little envelope like this. And what I always say, the analogy I always use, is the difference between what the medical doctor does looking at your blood hormones, although that is considered the gold standard in medicine. It really is just like looking at the book versus reading the story. The story comes in the form of the Dutch test. Now, both together would be ideal. But again, what the Dutch does, it gives us a 17-page report that's totally custom built, personalized for you, showing you what your hormonal story is and identifying like what's really going on in there. Because everybody has something very different going on inside of them. Everybody's biology and physiology is totally different, depending upon your age and many other factors. So as the hormones are moving through the body, think of it like this fountain analogy, where you have up here like the parent hormone, pregnenolone. You have pregnenolone, and then from pregnenolone you have DHEA, which is considered the youth hormone, and the precursor to all of the other hormones. And then DHEA spills over here to testosterone, and then testosterone can either go down the right pathway or go down the wrong pathway. If it goes over here, it turns into something called DHT, which if you're a man, makes you go bald and swells your prostate. It's not good. It's 3 times more powerful than normal testosterone. What pushes it over here? The thing that detonates a man's testosterone faster than anything else? Lots of sugar, white refined sugar. And when I look at a man's testosterone level, 99% of the time, I know if it's like coming in at 100, 150, 200, where it should be like 6, 7, 800. I know, for the most part, what they're doing at night, just about every time. I'll say to them, so every night you have a big bowl of ice cream, right? They're like, hey, how'd you know that? Or are you having like, you have a sweet tooth and you have like a big bowl of Fruit Loops or something to, like, what are you doing at night? I want to know that because there's a lot of sugar going in your body. And that probably combined with no movement. You know, you need to get off your butt, weight train, shove the sugar away. And there are a lot of things that can skew hormones, but the main thing, sugar. A man is eating a lot of sugar and the years are going on, they're going to look like the guy on the left side in the beginning of the slides, like I showed you. Okay? Lots of fried food, lots of sugar. For a woman, it's stress, emotional stress. Emotional stress will create a big, big problem, especially with the stomach and the liver backing up the bad estrogens. So you have testosterone, and then as it's flowing through, testosterone is needed to create estrogen. So from testosterone, estrogen is created, and then after the estrogen is used, you have 10 different types of estrogens. One primary form is E2, estradiol, which shows up on your blood panel. And then what happens here after it's used, then it goes down these pathways. The majority of it is, these are liver detoxification pathways. It should go down here, like 80% of what the liver is doing should be down this pathway. And that's the pathway of good detoxification, moving down, and then over here, this is it pushing it, bile, taking the bad estrogens from the liver, bringing it into the colon to be pooped out of the body. That's kind of what's going on here. So there's a lot of stuff that's happening. If it's going down these pathways to any large extent, these pathways cause bad toxic estrogens to build up in the body, which have been directly linked to breast cancer, uterine cancer, ovarian cancer, and a lot of other cancers. So it's really important that all of these are flowing well. Now, there's a way to naturally influence these pathways. There's a way to non-pharmaceutically impact this. However, without testing, we don't know. And that's what is the problem with drugs. Like, everybody gets the same solution, and guess what? Even functional medical doctors, natural doctors, basically say, oh, here's your number on a blood panel, your estrogen's lower, this is off, I'm going to give you a supplement to manipulate this number. And that's a bad idea too, because without really understanding what's going on, the pathways, that may not be what you need. So for example, what happens if your estrogens are really high on your blood work? Well, that may make it look like your testosterone and progesterone are really off, or what have you. It may give you a misreading. But it also could mean, and this could be missed, that this right here can show that your liver is not detoxifying properly, and your gut, also what shows up on here, actually on the next slide, is a marker that shows that your gut is not working effectively, thereby causing the bad hormones to reintoxicate your body. So this really gives you an overall picture. So there are things like, for example, saw palmetto, stinging nettle. If you have a lot of the bad, strong, powerful, negative testosterone, it can push you back over here and move you in the right direction. If you have too much estrogens flowing in the wrong direction over here, then we can give you some DIM or cruciferous vegetable supplements, move you down the better pathway. If your stomach is not getting rid of the estrogens properly and things are coming back, there's a supplement called calcium deglutarate. So there's a lot of things you can bring in. If things are backing up, for example, testosterone is supposed to be aromatized and brought into estrogen. If a male has too much estrogen in their body, they may be converting too much testosterone too quickly to estrogen. Well, there's something called passion flower. Passion flower is an herb that can literally push this back so the testosterone bucket fills back up. There's also something called white peony. If a woman is struggling with the estrogen, this can speed up the aromatase enzyme and make more estrogen in the body. Natural substances. But does this person in front of me need it? I don't know. I don't know until they get the right testing. So there's a lot of stuff. Chaste tree, this is progesterone. Chaste tree is another natural liquid herb. You can get the dry herb, but the liquid herb is potent because it actually enhances the production of progesterone naturally. So there's a lot that can be done from a natural perspective. This is the stuff that pushes things down the wrong pathways. We already talked a lot about these things. I'm not pro-alcohol. I don't have a problem. We talk, wine, whatever you want to have. Whatever you want to do, that's your business. But I can tell you, if you want to balance your hormones, I always say, just give your body at least like a 90-day hiatus from the alcohol. Give your body, your liver, your stomach, your gut, your body in general, a chance to heal. Because sure, you can enjoy the alcohol, wine, but at the end of the day, it doesn't really do anything constructive health-wise for the body. It really doesn't. And so all the reports that have come out over the years, I know I now have become much less popular tonight, but that's okay. They're all put out there by the wine companies. But nonetheless, these are the things that really push these pathways in the wrong direction. what the Dutch test does, it's a simple, and I'll end on this. It's a simple take-home test. It's a, you get pee strips in here, and you do a collection over about a day. Simple instructions. Just got to make sure that you read them, because it doesn't work out well when you don't read them. Right? So read them closely, carefully, but simple to do. And they're pee strips, and then what happens, you send it off, mail it off, and it comes back with a 17-page report, and it looks at 3 different things. First, it looks at sex hormones. It looks at progesterone, testosterone, and estrogen. It looks at the pathways, how things are moving through your body. It also looks at stress hormones, particularly cortisol. Very important to understand that picture. And then what it looks at is something called the organic acids. And again, the body needs, for example, like what you're seeing here, it needs a lot of B vitamins to detoxify. So it's going to show you deficiencies in the things that are necessary for your liver and your gut to work normally for normal hormonal balance. So we look for deficiencies. Are they in range, outside of range? Glutathione is very needed for the liver to detoxify. Indican, if that's off, that is a marker for gut dysbiosis. It means that you have a gut problem. If you have a gut problem, you're not going to convert manufactured hormones and you're not going to detox well. Dopamine, and if these are off, it can mean that your hypothalamus is working overtime and you're in a lot of fight or flight, a lot of dopamine, a lot of stress hormones being produced. You want to know what's going on with these right here. So it's looking at these stress metabolites, it's looking at cortisol, and it's looking at the sex hormones. Just a little bit of bonus material here for you. Estrogenic foods, cacao raises estrogen in different forms. Cacao. Right here, I got in a lot of trouble for putting this up here last time because my wife was at this master class last time, and this is her favorite snack. And she said, "Why'd you put that up there?" I'm like, "Why? What did I do? Did I do something wrong?" She's like, "Yeah." She's like, people are going to be like rushing the stores. They're going to be out of my chocolate. And that's my chocolate. She's like, "Don't tell anybody about that." So I'm like, "Don't worry, I'm sure there'll be plenty." I'm like, "If you want, I'll call the company. We'll start carrying here or something. We'll have it directly shipped." But this stuff is amazing. Fresh Market, Chamberlain's, you can get it anywhere. This stuff is incredible. 70, 80, up to 90% cacao chocolate, low sugar. It's good stuff and very helpful to balance estrogen. Who would have thunk it? Testosterone, supplements for men, zinc, oysters, perhaps the world's perfect food for the body, but especially for male health. I don't eat oysters. I can't stand the thought of even having an oyster, but you can get like our liver supplement. You get it desiccated, but incredibly rich in nutrition, vitamins and minerals, zinc, incredibly important for male health, for sperm and testosterone production, incredibly important. Green tea, chrysin is found in raw, local honey. You can find it. Green tea, Mura puma is found in South America in the Amazon rainforest. It's a bush that actually increases free testosterone and increases sex drive naturally. Cruciferous vegetables. Quercetin, saw palmetto. Some of you guys are taking that in our immune supplement. Saw palmetto and nettle extracts, that actually pushes that flow down to the normal supply of testosterone, away from the negative one. High-dose vitamin C and bioflavonoids support great adrenal function as well. So that's what the Dutch test is. I wanted to talk to you about it. For those of you guys who are struggling with hormonal issues, who just want to find out more, want to be proactive, preventive, this is right now the gold standard in natural health, Dutch. Chances are, if you talk to your mainstream medical doctor, they're not going to know about it. They probably have never heard about it. They know about blood markers. In the medical world, are considered the gold standard. But the ideal scenario for me is to have both. But I believe that really tells a bigger story, the Dutch test. So that's what it is, looking at the pathways, looking at the stress picture, looking at the organic acids. And that's what the Dutch test does, and that's what it's for, and that's who it's for. Great choice to evaluate heavy and painful periods, hormonal acne, hair loss, mood swings, PCOS, PMS. Try to identify things, issues that maybe other doctors haven't been able to solve. Maybe even trying to figure it out on your own. Menopausal symptoms, including hot flashes, night sweats, mood swings, could also be addressed with a Dutch complete test. If you're using bioidenticals, it's a great way to monitor your hormones, right? The blood markers are important, but this is also a very important thing. So there's the picture. Lifestyle, can't get away from it. You got to include these things in your lifestyle. You got to make sure that you're working with the body, not against it. Did you guys learn anything tonight? Good, glad you came. I would rather you, if you are going to take even natural things for your hormones, I would prefer that you get tested first. That's ideal. But these are all the things that are looked at, all 10 estrogens, all the androgens, the male hormones, the progesterones. There's 2 of them that are looked at. 17-page report. There is no cost for active patients to review the lab report. The other scenario, we can get a lot done just with the Dutch test. But if we really wanted to get all the data points and get the most complete picture, then ideally you'd want to include the blood hormones. And these are the major ones. If you want to include a complete thyroid picture, the thyroid antibodies, cortisol. You can get this done. If you want to bring this panel to your mainstream medical doctor, they may authorize it. You can run it through your insurance. You can do it that way. Sometimes they will, sometimes they won't. Or we have a phlebotomist who can do the draw for you out of pocket. It depends upon how you want to do it. Ideally, if you can get this authorized through an MD, then many times you can run it through insurance. But again, this is a complete thyroid picture as well to understand what's going on there. So, thank you for coming tonight. Did you guys learn? Yes. One request I just ask you. If you guys got even one small thing out of tonight, one little tidbit, one gold nugget, the only thing I ask is this. Next month, cancer prevention masterclass. I ask you, and we can make room for them, don't worry. We'll make rooms, we'll build some bleachers. I ask each and every one of you guys, bring one guest with you. And I know many of you guys have tried, but just do your best. They don't show up, okay. But why am I asking that? Why is that important? Why? Save lives. Do more people in the community need this information? Heavens, yes. So please bring others, family members. Let other people know that they can come here, even if they're not under active chiropractic care. We want to get it out there. Thanks, guys. God bless.
Keeping families healthy.